Did Medicare Advantage achieve its goals? President George W. Bush, who signed Medicare Advantage into law, said Medicare Advantage would lower costs, expand benefits, give more choices, and make care better. People do have more choices because in many countries, people can choose from a variety of Advantage plans on top of normal traditional plus supplemental options. However, this is a greater choice in insurance. The goal is good healthcare and choice in healthcare. Advantage enrollees have less actual choice in healthcare due to narrow networks and denials. Advantage offers less benefits due to denials, prior authorizations, and narrow networks, but does offer extra benefits like vision and dental. I don't think this should be marked as a success of expanding benefits, but it is something. It's not clear to what extent Advantage has made care better, but it's clear some level of efficiencies were gained. Advantage has forced some providers and beneficiaries to be more economical in their use of medical care. However, Advantage plans have done this while gaming the payment system and getting way overpaid, costing the taxpayer significantly more. The hope for privatization, like Medicare Advantage, was that capitated payments would incentivize providers and insurers to reduce costs for profit by keeping people healthier and using prevention to avoid expensive interventions later, as well as good care coordination. Unfortunately, actors with their eyes set on maximizing profits have abused the capitated payment system to turn resources meant for patients into profits. CEOs of major Advantage insurance companies get paid millions of dollars, and they are not paid to care for patients. They are paid to make profits. They have done this successfully while failing to save the taxpayer money. The main upfront goal of Advantage was that it would help Medicare by saving the taxpayer money. This has been a 100% ridiculous failure. We cannot claim that Advantage is a success while it still gets overpaid year after year, worsening the Medicare funding shortfall. This also mitigates other claims about the successes of Advantage because current comparisons between Medicare Advantage and traditional Medicare are kind of bullshit when the government is paying more for Advantage than traditional. It's easier to be more efficient and gain more enrollees when one has a huge bucket of taxpayer money that allows one to design plans that outcompete traditional Medicare, who is paid less by the government. Advantage plans should compete on better quality health services, better access, and price. Instead, they mostly compete on price. They offer free money to spend at a drugstore or other bullshit that is not really health benefits. Advantage provides less access to less procedures and less doctors and less facilities. So its selling point to customers is cheap premiums and niceties that are nice, but not core healthcare. Unless you put an amazing amount of weight on Advantage's coordination benefits, Advantage doesn't really do much helpful for the person who actually needs healthcare. It is just a cheaper insurance that limits access more than traditional Medicare. The main advantage of such a system would be saving us all money. But it doesn't do that. It costs more in total. If Advantage's only benefit was saving us all money, I may support it, but Advantage hasn't even done that. If we need a yes or no on whether Advantage has achieved its goals, the answer is a clear no. Improve traditional Medicare? Comparing traditional Medicare to Medicare Advantage is misleading when we consider that Congress could easily make traditional Medicare better, but has refused to do so. A $5,000 maximum out-of-pocket for traditional Medicare has been estimated to cost $39 billion as of 2024, which is 28 to 44% of the overpayments to Advantage in 2022. In 2023, traditional Medicare could include dental, hearing, and vision for an estimated amount less than $42 billion. That is 30 to 48% of the overpayments to Medicare Advantage in 2022. So, from the savings of fixing the overpayments to Medicare Advantage, traditional Medicare could include the key coverage benefits of Advantage in traditional Medicare. It would be great for traditional Medicare to offer vision, dental, hearing, and a maximum out-of-pocket without the need for supplementals. But with the current deficit and debt situation of the country, savings from fixing an Advantage payment system should probably put toward reducing the deficit. It is, however, important that traditional remains a viable option that people choose because Advantage depends on it. Advantage plans use traditional mandated prices to negotiate with providers, so maintaining a healthy traditional is needed for how Advantage works. If you improve traditional Medicare, then you could match Advantage spending to traditional spending without lowering the benefits of Advantage plans. We could get rid of rebates and just let comprehensive coverage be standard across all Medicare. Many Advantage markets are concentrated, so a strong traditional Medicare is important as a competitor. Therefore, improving traditional may improve Advantage as Advantage plans are forced to compete with a stronger traditional Medicare. Traditional also may help limit the race to the bottom, where plans are particularly restrictive in order to avoid costly patients. If traditional remains a good option for costly patients, Advantage can be less strict and still avoid signing up most of those people. This would be ripping off traditional by making them have the most expensive patients, but may actually make Advantage plans better as they have less worries about a handful of very expensive patients cutting into profits because they go to traditional Medicare. What should we do about Medicare Advantage? One of the main points to Medicare Advantage was to utilize the efficiencies of the private market to save the taxpayer money, to help keep Medicare affordable to the taxpayer. That has been a massive failure. Medicare Advantage has cost more than traditional Medicare in every year of its existence. Private entities have shown themselves far more nimble at gaming the capitated payment system than the government is at paying an appropriate amount. Reforms have been made, but insurers adapt and the overpayments continue. What do we get for that? Some efficiencies here or there, maybe some better outcomes here or there. People get a sweet deal on cheap insurance that is less likely to actually cover their medical needs when they need it, and more likely to be burdensome with narrow networks, denials, and prior authorizations. The insurers don't even have to pay for some people who, after paying cheap premiums for years, switch to traditional Medicare when they have expensive medical needs, allowing the private insurer to keep those years of capitated payments and premiums without actually insuring the enrollee. The extra costs of Medicare Advantage are clear and in the realm of fact. The burden of extra administration on doctors, nurses, hospitals, etc. are in the realm of fact. The burdens of denials, narrow networks, and prior authorizations are in the realm of fact. Improved efficiency beyond simply discouraging use of the healthcare system is not as clear. Neither are any potential health benefits, which seem to be a mixed bag. The evidence is strong enough to conclude that Advantage plans have found some efficiencies and that these have even spilled over into traditional Medicare and the under 65 commercial market. However, are these worth the consistent overpayments when the Medicare program and the government in general have major deficit issues? No. If Advantage can't achieve possibly its number one goal of saving the taxpayer money, then it should be phased out. So there are only two real options with what to do about Medicare Advantage. One is to get rid of it. Use the money saved either to lower the deficit or improve traditional Medicare. The other is to get much tougher on payments to Medicare Advantage plans. The system should be set up as to guarantee that Advantage gets paid a little less than a similar patient would cost in traditional. Advantage was supposed to be cheaper than traditional, so make it cheaper. Unfortunately, this is easier said than done. Specific solutions are not the focus of this piece. In the written version, I do bullet point several that I read about, and you're welcome to read about it there. But I'm not going to drag this on any longer by listing those out. So I'll move on. A study looked at Medicare Advantage spending in metropolitan areas just above and below 250,000 population, because those just above get a substantial reimbursement increase. The additional payment leads to more private firms in the market, a higher share of Medicare beneficiaries in Advantage plans, 1/5 of the additional money being used for medical coverage, more being used for higher profits, and a large impact on advertising spending. That doesn't sound like a quality use of additional taxpayer money to me. If that increase was given to traditional Medicare, a much higher percentage of it could be used to expand benefits, or it could be used to help sustain the Medicare program. This study also suggests the current amount of money given to private Advantage insurers is not being spent well and is well in excess of the amount needed for medical care and modest profits. The Affordable Care Act had some cuts to Medicare Advantage payments, but they were not equal across counties. A study looked at the resulting enrollments from those counties for 8 years after the act and found no difference between counties that had larger cuts and those that had smaller cuts, concluding that the differences in cuts to Advantage payments did not affect Medicare Advantage. This study indicates that Advantage may be fine with lower payments. But either way, if Advantage plans can't survive and offer a good product at cheaper than traditional Medicare, then that just proves that private insurance is inferior to traditional Medicare. We've got to get tough on Advantage plans and make sure they are paid an amount lower than what it would cost that patient to be in traditional Medicare. Let Advantage companies make profits off their efficiencies, not from ripping off the taxpayer. Improvements in profits based on private efficiencies was the whole point to Advantage in the first place. If they can't do that, then they are not enough more efficient to continue existing. If Congress, the President, and the bureaucracy cannot keep up with private insurers gaming the system and therefore cannot pay these insurers an appropriate rate, then we should end Medicare Advantage. Well, I'm Lone Candle. Like me, comment me, love me. Mm-hmm.